Good evening and good morning to those joining us from another part of the globe. Welcome to the October 2025 series, Face Yoga, Autism, and today's topic on the occasion of World Mental Health Day is clarity through face yoga, supporting autism and mental health. So our topic is clarity through face yoga, supporting autism and mental health. We have a guest speaker who would join us shortly, Dr. Reshma Palep, a breast cancer surgeon who each day takes brave steps towards healing, growth, and self-awareness. So we will first complete our face yoga capsule and await our guest for today. Yes? How do we say the face yoga way? We breathe in, we breathe out, we smile, get ready, and say yes. Yes, and then we tap. So, let's say it one more time. We breathe in, we get ready, and we say yes. Relax. Okay, so face yoga are a series of exercises, research that focus on the 57 facial muscles of the face, neck, and the scalp. It's observed that when 57 muscles are exercised, it stimulates the central nervous system, the brain, and endocrine glands, increasing blood circulation to the facial muscles, the face, that is, the neck, and the scalp. 57. Your 57 muscles. Face yoga is for everyone. Be on the autism spectrum, the caregivers, family, and friends. It's for everybody. My name is Minal Potnis, and I am an evangelist of the face yoga technique for beauty, wellness, because we have the endocrine glands here, the pituitary and the pineal, thyroid, the occiput group, and neuro conditions such as autism, ALS, facial palsy, and such. So let's start. How do we start? We always say yes, right? We're going to say yes the face yoga way again. So smile, get ready, and yes. Hi, Reshma. We've been just talking about you and we're waiting for you. We'll have just a quick, what we'll do is we're going to ask Dr. Reshma to speak to us, and then we will do the face yoga capsule. Normally we have a quick capsule, but we're going to do that the other way around. However, I'd like to introduce you. May I take a minute? And then we'll just hand it over to you. So today, it's my pleasure to welcome Dr. Reshma Palep. She's been kind enough to join us. She is an MS, DNB, MRCS, into brackets ED, and a consultant surgeon of breast cancer. That's a super specialty at the Sri HN Reliance Foundation Hospital and Dr. Palep's Polyclinic. A brilliant surgeon known for her compassionate approach Dr. Palep often says that more than half the battle is won in the mind. Her work beautifully highlights how inner strength and emotional balance are essential, not only for patients, but also for caregivers walking beside them. Today, she shares her reflections on nurturing that quiet inner equilibrium that anchors both healing and hope. Dr. Reshma, could you share with us how inner strength and emotional balance help both patients and caregivers through the journey of healing? I understand there is an emergency and you may have to leave us, but we'd love to have you with us as long as possible. Over to you.
Thank you, Minal. Just came from a Karwa Chauth Puja, so today is a very auspicious day for women, and along with that, there is mental health awareness week going on, breast cancer awareness month going on. So lots of activities. All these activities are actually to promote a lot of strength and companionship, among people. All these social interactions, they promote a sense of social interaction and give each other strength. Every interaction gives each other more strength. And as a cancer doctor who's been, dealing with cancer patients, especially women, these women today we are finding patients who are below the age of 50. Cancer in India affecting ladies below the age of 50 is now 50%, half the number of cancer patients. And these patients who are below 50 are the very center of the family. They are still a wife, still a mother, still a daughter-in-law, still a daughter, looking after everybody. So the whole home revolves around this woman. And then when she is detected with cancer, suddenly you feel like the whole system is going to collapse because she is the center of everything. So providing emotional support and this comfort to the woman, to make her understand that it doesn't matter if there's this huge storm or a cyclone that suddenly hit her life out of the blue. She never expected it to happen, but it's just hit her suddenly out of the blue. But it's just a temporary phase where, this is just 6 months and you're going to get out of this. There's a very dark tunnel ahead of you that you can see, but at the end of the tunnel, there's light. You need to see that light. You need to gather all the strength that you can, all the positivity, whether it's the doctor, the other caregivers, nurses, other doctors helping you, family members. Everyone is on your side. Everyone is rooting for you, that you're going to come out of this battle very victorious at the end of it. And building this strength in the woman is very important. And the ones who have managed, because there's so much negativity related to cancer, everybody around is talking, some neighbor is giving advice, this happened to this patient, that happened to that patient, somebody took chemo and somebody died and somebody lost hair and all those things. So she's really down in the dumps the minute she's diagnosed, because she thinks the worst is going to happen. But it's all so much in the mind that if they are able to overcome this, then they are so receptive to the treatment. Like just yesterday I had a 35-year-old patient, and she told me very positively, doctor, aap jo bolenge main sab kar lungi. And as a doctor, I was anticipating worries, because other people might point out things to her, and she may they differ from the treatment. If you say you need surgery, chemo, radiation, all those things, they don't want to go through. They may default at some point and leave something out. And she was so positive that she said, doctor, aap jo bolenge wo main karungi, sab kuch karungi. And then when they are all in that positive state of mind, then it's really very useful and to us, and beneficial, by which we can really get them to over to the other side. And some of them are so motivated that after the treatment is completed, they tell me, doctor, agar aapki koi patient ho who needs help from me, you please let me know. So I've seen the patient, I've done the surgery, and they go through very bravely the surgery sometimes, I feel, because they feel they have to muster all the courage and go through it. But the evening of the surgery, suddenly hits them, that now my surgery is done, tomorrow what will happen to me? So I call the other patients in as a support group, and they'll come and sit with the patient and build up the patient's morale. So I have this small network of patients who like to work as counselors themselves. They will tell their own experiences. They're already leading a very healthy life. Everything is restored back to normal. Their hair is normal. They're back to all the activities that they were doing. And then the minute that patient sees the other patient in front of them, who's a cancer survivor, as we call it, they are totally relieved, of the worst that they are imagining in their heads. So much is in their heads, that they are imagining these things in their head. And then when they see the patient again, the nurses, everybody else who is building up their morale that, your journey is going to be smooth, you're going to get past this, they really respond to the treatment much better. So we have a network of people, not just the nurses, doctors, caregivers, but especially ex-patients also who come back and pitch in to help the next cancer patient through the journey.
So how do you like to link the autistic caregivers? Okay, they may not be suffering from cancer, but there is a condition, and the caregiver has to support, which also makes a whirlwind of her life, or their life, family, friends, whatever, caregivers. So how do you want to correlate mental health's importance in that sense, or what would
So
you like to?
when we talk about autism, first of all, the understanding of society, what is an autistic child? I mean, I have somebody in my building, and gradually the other people in the building are getting to know, that this person is different. He's not going to be able to interact, do other things like other children. But whenever the child is doing something, so there's a child minder with that child all the time. They don't leave him alone, and he's conducting going through activities. The others stay back around, encourage him. Always clap when he achieves something. Because as an autistic child, if he's kicked a ball into the goal in football, it's a greater achievement for him than a normal child. And everybody stands around and applauds, the child. So I'm sure your caregivers are also trained in such a way that these are special needs children, and their special needs are also related more, not just the physical inabilities, but mental and emotional needs as well they have, which are different from the others. And so you need to support them all along, all through the journey. And every small step, I think everything that they achieve really should be applauded and appreciated, that wow, you've done a fantastic job. And you can see the smile on their face, immediately they look around and they'll be like so happy. Oh wow, suddenly somebody's feeling happy,
Yeah.
because there's a struggle going on inside them, which they can't really communicate. And then suddenly when you applaud or appreciate, they turn around and they feel so happy, like, oh, somebody's actually recognized that struggle inside me, despite which I achieved this, and someone is clapping for me, So this appreciation and giving back a lot of positive feedback also is very, very important.
Absolutely. And then the last thing is, for the caregiver, the mother or the father, the parent, or, the extended family who is day in and day out dealing with an autistic child or a family member. And, ultimately, you also need motivation, like you said, as an individual, a normal individual, but you're taking care of somebody which needs an extra 2-3 miles. Mental health is important, and how would you like to just touch on that?
Mental health is important for everybody, regardless of whether you're a patient suffering from an ailment or not, and in every walk of their life, because the mind really controls everything. As soon as you wake up in the morning, if you're in a positive frame of mind, then everything goes positive, the day goes positive. And if you're not, then things can just go wrong. So it's important for each and every individual to be in, the best of their elements mentally as they can. And now, with longevity, there's dementia and other illnesses coming in, where the person can't really control his activities in terms of mental health, mental strength. The whole world, right from maybe not a newborn baby, but it's young children, to the oldest person around, everybody needs to be in a good mental frame of mind to go about their lives in a very happy way. You may have all the money in the world around you, all the wealth, but mentally, if you're not in a sound state, then all of that wealth or any other comforts, luxuries are of no use.
Absolutely. So I think this is a key takeaway from this brief conversation with you, which is, I think, very enlightening, small, sweet. I understand there is you need to step out for something urgent. So I will not hold you back, but thank you for sharing. And This has been perfect for me and for the viewers as well. So we'll see
Thank you.
you
Thank you,
later.
Minal. I would love to stay on and attend your
I
session, but
understand.
I'll take a rain check
Yeah,
on that definitely. But I have to commit that I will definitely do it in the near future, very soon.
absolutely. We're calling you back, and we'll again try and sink in another topic, which will give us a part of the autism ecosystem and bring in your expertise also. So we look forward to seeing you.
Sure, sure.
Okay. Good
Thank
night.
you. Bye. Have
Thank
a
you so
nice
much.
evening.
Bye bye. Okay, that was wonderful. And I'm happy that Dr. Reshma could share a little bit and give insights from her expertise, her perspectives. So what we'll do is, before we wind up, let's have our face yoga capsule. Yes, again, get ready, smile, and yes, relax. One more time. Get ready, smile, yes. Now, inhale, take in as much air as you can, and hold the position, hold the position, hold the position, and relax. Excellent. Excellent. Many people think that, oh, this balloon is only for beauty. Oh, I can use it for, neuro conditions. But you got to understand, please check with somebody who's a practitioner, because dealing with a patient, dealing with somebody for aesthetics is totally different. You've got to work on the muscles, you've got to understand the changes, and you have to regulate whatever exercise you're doing for a positive outcome. Okay? So let's start. Again, hold the position, smile. 1, 2, 3, 4, 5, 6, 7, 8, 9, and relax. Breathe in, breathe out, breathe in, breathe out. One more time. Can we do that? One more time. Inhale, hold the position. 1, 2, 3, 4, 5, 6, 7, 8, 9, and relax. Breathe in, breathe out. Breathe in, breathe out. And now I want you to just sit straight, raise your eyebrows, touch the ceiling, and hold the position. 1, 2, 3, 4, 5, 6. Look up, feel happy, be relaxed, and relax. Good job. Tapping. We always do the tapping, right? Why do we do it? Because we're working on certain meridians. We have spent a lot of time understanding the correlation with meridians. It's not just about tapping for the sake of tapping. Excellent. Breathe in, breathe out. Breathe in, breathe out. Get ready. One last time. Up. Hold the position. Look up, look up, look up. Hold the position. Smile. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. And relax. Tap, tap, tap some more. Excellent. Good job. Now, I want you to open your mouth, be relaxed, and say, ah. and close your mouth. Yeah, can you do that? Breathe in. Ah. Get ready. Breathe in. Ah. And relax. Inhale. Exhale. Inhale. Exhale. And quickly tap along the line. Excellent. Very good. Now, what I want you to do is crouch like a rabbit. Take your nose and crouch for the position. 1, 2, 3, 4, 5. Relax. Good job. Breathe in. Breathe out. Breathe in. Breathe out. Now get ready. Scrounge, scrounge, scrounge. And relaxed. Inhale. Exhale. Inhale. Exhale. Again, get ready. Stop, 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 stop. Relaxed. Inhale. Exhale. Inhale. Exhale. And quickly tap. Yes. So, on Mental Health Day, let's smile, feel positive. Things could be tough, but tomorrow is a better day. Learn some techniques that help you to be centralized. Face yoga is one of them. Could be Tai Chi. Could be breathing exercises, the Tibetan breath work. Could be different forms of meditation. Could be playing chess. Could be painting. Figure out what's good for you, what works for you, and have a combination and smile. With that, we're going to say goodbye and we will meet next month. Ta-ta.